All right, we're going to go ahead and get started. Good morning, everyone. Welcome to today's Recovery Summit presentation. Um, Substance use and suicide prevention in the veterans population. Sorry. The webinar is part of a series hosted annually by St. Clair County Community Mental Health during the month of September, which is National Recovery Month. Today's session is being recorded and will be uploaded on the CMH YouTube channel for future reference. Please feel free to use the chat box for all questions or comments. Our presenters will be answering questions as time allows. Continuing education credits are offered for today's presentation. If you are requesting professional credits, you must remain on the webinar the entire time and complete the survey at the end of the presentation to receive credit. Our presenters today are Katrina Bashirs and Christina Mariani from the Detroit Veterans Health Administration. Welcome.
Thank you so much, Christy, and thank you to all the folks who are here. We appreciate you taking the time and space to be with us, and we're thankful to be invited into your space. And so we hope that you will walk away today with some information, and maybe we can learn from each other as well. As Christy said, we will be processing questions throughout. Christina and I will be presenting in tandem, and we do this a lot, so we're pretty comfortable if folks have a question, and we're going to just flow with it. Today, like Christy said, we wanted to just say thank you to her. Thank you to Adrian Luckenbacher for the invite as well. It's a very organized office, and they've really put together such a fabulous menu for the month of Recovery Month. It's really exciting to see all that and actually be a part of it. So we thank you for that. And so also we have some friends in St. Clair County. Detroit VA, as Christy mentioned, we cover Wayne, Oakland, Macomb, Sanilac, and St. Clair County. So that's one of the reasons we're also very excited to be invited into this space with you as well, because you are in our catchment. You serve a lot of our veterans, and we actually serve a lot of our veterans who don't choose to come to VA for whatever reason. So thank you for taking the time today to be here, and hopefully you'll walk away with something. So um, I just got to do a shameless plug and shout out also as well for our St. Clair County veteran navigator, Wendy Martindale. She has been a huge asset, especially for folks who are trying to get connected to Detroit VA healthcare system or connected to the ELC box. Since you're a little bit farther from our hospital, sometimes we have some creative ways that we can serve our veterans and ensure that they may not be getting copays or have just ensure that they're getting the appropriate care they need. And so she's really been a beacon over the years for that. And if you have other folks who are also interested in receiving care or getting benefits related to VA service, the St. Clair County Veterans Affairs Office is also superstar office. Ryan McCann is the director over there, and he's got a fabulous staff that really does advocate for our veterans as well. And so just so you know, there are resources out in your county, and we work collaboratively, and we just want to ensure that folks know where to get the help that they may need. So thank you so much for that. My name is Katrina Bashirs, and my counterpart is the wonderful Miss Christina Mariani. We have had the pleasure of working together at the VA in a few different realms, one being substance use. We both worked in that clinic before we migrated to suicide prevention. So this population, this topic is very near and dear to our hearts. We did not formally serve, but we both have family members, loved ones. We both are younger sisters of service members and grandpas, fathers, ancillary folks like that. So we get really passionate about this topic. And again, just really thankful to be in this space with you. So I will flood into that, go into the actual content of the program. I appreciate your grace and space in this. So the overview for what we're going to be covering today, hopefully by the end, you will be able to identify at least 3 unique characteristics of our veteran population and implement this into recovery and safety planning. We know that there's a high correlation with substance use and suicide. And I know you guys also had a webinar on that recently. So we're going to touch on that a little bit. We're going to learn about the impact of substance use recovery as it relates to suicide prevention, and also talk about some of the innovative ways that VA is really implementing support for our veterans and their family members around suicide prevention and substance use recovery, because we know that those oftentimes meld in the same world. So And I know CMH is doing a lot of amazing things as well. And we know that we're stronger together. So the more we leverage all these things and share ideas, the stronger impact we can have on our community. And also forgive me before we get started. I know that this is a different kind of format, but I just want to recognize our service members or veterans who may be on the call. And I just want to say thank you for your service. Thank you for your sacrifice. Thank you for your continued service in this space. Just even if you're a learner or a provider, we know that we just appreciate you and your work and the family members, because we know that as family members, we have little extra affirmation for our veterans and service members. So thank you. A lot of times I make you raise your hand or request you to raise your hand, but in this venue, we won't this time. So, okay, a little housekeeping before we start. Most of us are likely providers. We're likely comfortable in this space talking about hard things all day, every day, which can be challenging. Hopefully you're fueling up on your downtime if you have any. But recognize that suicide can be an intense topic. We have immediate resources that you're really probably already aware of. 988, I know the St. Clair County Suicide Prevention Coalition has done a fabulous job of really pushing 988 material out to everyone and making your county really equipped in that. They've got some great partnerships, but we know that sometimes, I know for myself, even though I've been in the field for a while, I'll be in a training, I'll be in a meeting, I might meet someone, and then it strikes me a little bit later differently, and it hits somewhere differently. And we just want to recognize that sometimes that happens, and to attend to yourself if you need to. Christina and I will be available after. Our contact information will be shared if you want to reach out to us separately, or I'm sure you have a broad network yourself here in the county. Please know, no harm, no foul. We're all humans at the beginning and end of the story, beginning and end of the day. And sometimes things hit us differently than other days. Maybe you didn't have enough coffee or enough sleep, or just a rough go. So just attend to yourself as you would your loved ones and your patients or clients, consumers. Okay, so you're probably already familiar with this, but Christina and I really like to just do a little blurb on this slide, a little reminder, a gentle reminder, friendly reminder to folks that, the really cool thing about human services and social services is that it is a growing field, and we do better when we know better, and we can improve as we move along our helping career spectrum. So on the left, you'll see our preferred language. So in the science of suicide prevention, our language has changed. We know that language matters. We know that the words we say have a strong impact. And a lot of times the things we don't say have a strong impact too, right? So we want to use concrete language when we're talking about suicide. We want to move away from the criminalization of suicide, just like we move away from the criminalization of substance use, right? We want to get back to that human component. So this is just our friendly reminder to one another about the language we want to use. So I'm just going to keep rolling, and Miss Christy or Christina, if there's a question, just feel free to interrupt me and I can pause. So I'm doing a temperature gauge right now. Are we good?
All good.
Thank you so much. Okay, so level set. We are looking here at this slide at some of the VA trends in alcohol and substance use disorder. We know that this is a broad graph or a longitudinal graph from 2002 to 2021. You can see that again, these numbers, there's been a trend up. I know that there's been a little bit of a, I don't have the proper word, and forgive me. Nevertheless, there's been a trend up. We know that our service members and veterans tend to use substances more frequently than others. How many times maybe you've had a consumer say, well, the military taught me how to drink. If you enter in the military when you're 18 and you think about, it's your first time away from home oftentimes, and you have your 21st birthday while you're in the military, and all the things that are culturally relevant and appropriate, age appropriate for that age can oftentimes get magnified. And some people we've seen can grow out of substance use, and that changes levels off. And some folks, it ends up being their safety blanket. It ends up being their protective mechanism, and we'll talk more about that. But this is just to give some idea for you about the trends that we've seen and why VA has moved in some of the direction that Christina is going to speak about some of our interventions. So this is to give us some information, just intel on that. So as you can see, this breaks down a little bit more what types of substances are used. Interestingly enough, cannabis is very high, and we know that there's been some legislation around that, and we're going to talk about some of the reasons that may be the case. But this is just to give us a level set of that. So, Christina, do you want to add anything to the data?
No, I don't think so. Maybe the only other thing that I was thinking of was that there's no indication on these graphs of like polysubstance use and which of these people might be overlapping between these substances. So that's something to keep in mind too. We know that there's a high chance of that in general, and especially for our vets. So, but no, that's the only other thing I thought of. Thanks.
Thank you. Valid point. I appreciate you sharing that. That's what I asked you. Okay, so common reasons for substance use oftentimes are similar reasons to why a civilian may use. However, we have some nuances for our service members and veterans that are unique. So, and you might know this already, right? Oftentimes, they're commonly used for pain, for relief. I have a loved one that said to me recently who did serve, that he said, well, the vodka is what works, right? It's cheap. He can walk to get it. And his medical provider changed. He's someone who doesn't get care at VA because he's not eligible for whatever reasons. But when he said that to me, he spoke truth, and that hurt my heart. And we moved into that. But I mean, it's what works. It's what's helping me. But we know, unfortunately, that there's low strength evidence that cannabis and or alcohol could be used for the long term, right? It's just that quick fix. It's just that immediate fix. And there's a lot of other complications that may go around that. If you think about being 18, how your body felt when you were 18, right? I ran my body into the ground, but I wasn't in the military. I wasn't booted up, suited up, or carrying 30 pounds on upward to 120 pounds, doing drills in obstacle course, or let alone being in combat, carrying weapons and things like that. So, my 40-year-old body is tired and burnt out and feeling all the things, but I can't imagine what it would have been like if I was, had a trajectory, had a military career, even if I was in the Guard or Reserve and, had trainings once a month. I mean, that takes a toll on our body. So we recognize that our service members and veterans oftentimes have chronic pain issues that civilians may or may not appreciate the extent to which that pain is there, right? And pain is something that, we have pain psychologists at the VA, and we have some different interventions that we can provide because we know that can take people to a very dark place. So, but unfortunately, we know that this is only a quick fix. And we know that oftentimes it can impact our sleep cycle, which impacts the pain cycle, or can impact our appetite and things like that. Another reason that we see our military folks oftentimes using substances is because it's a quick fix for PTSD, post-traumatic stress disorder. And we know that if you're having nightmares or don't want to go to sleep, or if you're having a flashback and you're trying to relieve that high adrenaline stress response, that something that's going to calm you down, you're going to go to, right? You're going to go to what's easy. You're going to go to, and that's human nature, right? It's not veteran or civilian. That's kind of our human nature, right? I'm going to use anyway, enough said. The struggle though, which you may be familiar with, is that oftentimes it's hard to tease out what is the PTSD symptoms and what is the substance use system. Are you having delusions because you stopped drinking alcohol and that's part of the withdrawal response, or are they actually flashbacks and you are disassociating? And these are nuances that, as providers, it's really important when we're working with people, even if they're not veterans, but folks who may have a history of trauma and PTSD, to identify and kind of help tease out some of the differences and how to support them. Historically, there's been and continues to be conversation on, we got to treat one or the other. You got to treat the substance use or the PTSD. However, we've seen that there's a lot of promise and success when we treat both together, right? We are all whole human beings, and Christina's going to talk a little bit more about that in a few moments. But it's not just the veteran coming in and you're just looking at their PTSD symptoms. You're looking at their whole soul, their whole body, their whole person. So these are things that are important for us as we consider what kind of treatments to move forward into. We also know that substance use can trigger that cycle of depression, guilt, and the ancillary things that lead to suicidality, risk factors, which we're going to talk about in a minute too. That if my money's funny because I'm trying to get the drug that's going to make me feel better in the moment, and I just need to get through this moment because I got to take care of the kids or I got to show up to work, or whatever the situation is, go to class. The long-term effect, I'm not going to worry about my money later. I got to deal with that later, right? We're all like in the moment. And for our military and service folks, especially, oftentimes, and this is also part of our human nature. If you're used to being in situations where you have that high adrenaline rush that can often be rewarding in some ways for people, sometimes, and you come back to civilian life where things are pretty chill, right? You're not on tour, you're not in combat, you're not in training where you're trained to be alert all the time. This is also similar for our first responders, who are also at a higher rate military and service members, but that's an aside. The adrenaline rush from cocaine or some, a substance, right? We're looking for that same, oh God, help me, the reward cycle, right? We're looking for that. We're looking for the alleviation of whatever the itches that we have. So these are just things to keep in mind about why it may be more challenging for someone who has a history of trauma or someone who's experiencing chronic pain. And unfortunately, for the folks who suffer from both, right? So the attention and the support that you give that person in the room with you is so very important. And I just want to make sure that you recognize that your time spent with them in care and genuine response is so valuable. So as you try to map out and give them options, because a lot of times we need to give people options so they know that that we don't want desperation to set in, which we know can impact people's suicidality. So nevertheless, we'll move on. Christina, would you add anything else to that?
No, perfect. Thank you.
Okay. And so warning signs for our service members and veterans is really similar, but there are, again, some few nuances that's helpful as providers or loved ones to be aware of. We know about being hungry, angry, lonely, or tired. If my 8-year-old's freaking out, I'm like, did you have enough protein today? What's going on? Drink some water, right? He's melting down. Is this a blood sugar moment or do you need a nap? Like, what's going on? I mean, these are things that are basic human needs, right? And same with our military folks. Even though we expect them to be superheroes and oftentimes they know that they're superheroes because they've defied the odds. So why can't you get over this blood sugar moment? Well, you're still human and you're human right now in this moment. So we're going to attend to that. Okay. And oftentimes our folks, have been challenged to be, and we see this with first responders, firefighters, especially, you're on 12-hour shifts, 24-hour shifts, your sleep, part of the training is learning to struggle with not getting those immediate needs met, empowering through and defying the odds, and now kind of regulating that system and regulating that environment for folks and saying, hey, it's okay to take care of yourself. Taking care of yourself is actually taking care of your community, taking care of your family, right? And that's the social worker coming out of me. So another thing to be aware of, is oftentimes anniversaries can be difficult for our service members and veterans. We recognize that things like, my dad fought in World War II, but on Memorial Day, I didn't realize that Memorial Day was a difficult day for people because we're remembering the people we've lost. and it's a somber holiday, but it's one of honor, right? Veterans Day is where we celebrate the living, and we celebrate and honor those who have served. But the feeling is different. I remember I had a supervisor that gave us sent out, was educating us, being working at the VA hospital, say don't say Happy Memorial Day to people. It's not happy for a lot of people, right? You're memorializing the ones you've loved, the ones you want with you. And so it's that different, sometimes just these little context clues can help us as providers, help us as community members, as loved ones. If you have an uncle who, or a niece who's serving, right, they're going to look through that lens a little bit differently. 4th of July is supposed to be fun barbecues and fireworks, but fireworks, oftentimes we see a increase in our hospitalizations because it can sound just like gunfire, and that create flashbacks and people have episodes. And so these are things that when you're talking with your consumers or talking with your loved ones, just normalizing that, hey, I know 4th of July is coming up. What are your plans? And just like you would a substance use recovery planning meeting, just infiltrating it in simple conversations, normalizing it, I think is important. Oh yeah, when is that? Oh, it's actually Wednesday. Because if I'm always in avoidance and always avoiding my trauma, my pain, it's going to hit me at 10 o'clock, 11 o'clock at night, and I might be hitting the deck if I'm not prepared that those fireworks are going off, right? So we're just wanting to equip each other. The other, recent loss, that is excessive or impactful for all of us, any kind of loss, positive loss, negative loss. However, one of the most beautiful things about the military that I've learned is that there is this deep sense of connection and camaraderie that is unique and beautiful. We talk about, the survival bonding that happens with people. And even if you weren't, deployed, just having that unit, right? Having the people that you see once a month or you see, for training, and having the same people that you report to. I mean, there's a sense of community there that is difficult to recreate oftentimes for people once they leave the military. And we've seen there's a lot of awesome things happening in our area, in the Detroit metro area in Michigan. There's different things you can get involved in to create that that place of belonging again. But again, that's a human need that we have, and that if you sign up when you're 18, 17, and this is your peer group, and you're fighting for your life together, and then you're 24 and you come out and everybody else is just partying, and it's difficult to recreate, and it's really important to give space to that, and for us to create spaces to do that, and to be mindful that our folks may be more lonely than they let on. So nevertheless, we'll keep moving on. So some of the other things on this slide are very similar. I don't know that there's any other ones that I would highlight that would be different. When we talked about the change in eating or sleeping habits, so right, that's always a good context clue, especially for someone if they've had trouble regulating that anyway. What is that? Is that just because you're coming off drill, or is that because you are depressed, or is it both? Let's talk about that. Let's deal with that. So we just want to be mindful of one another and mindful with what one another needs. And then I believe that ends my section, and I'm going to turn it over to Miss Mariani. Thank you.
Thanks, appreciate it. And really quick, I just want to highlight, Ms. Warnock mentioned in the chat that VA can often be a trigger, and that's something that we hear in a lot of spaces as well, and in different ways. I don't even just registering, right? Going to this hospital that I've never been to fill out these forms, more government paperwork, and telling a stranger all of the stuff that I've been through can be really challenging. And then, if there's crowds there, and, if people are wearing, any kind of military memorabilia, it can be very triggering and challenging at times. So we're hoping we have more options within VA. We're trying to get more, community outpatient clinics posted up so that it can be a little bit less intimidating. And of course, relying on our community partners that service our folks as well has been a really big help to have options, right? We want our folks to have options. We don't want the only option to come to the building that makes you feel awful. Yeah, and especially now I think the word talking about triggers has become so normalized in society that people use trigger to describe a lot of different things. And it can also, there's a lot of, oh, you're being overly sensitive and you're, you need to just suck it up, or, a lot of these things that can come along with that too. So yeah, definitely appreciate that. And yeah, there's a lot of nuance there for sure. Okay, so we have our protective factors and support network. So to the flip side of our risk factors, we also know that our veterans and military folks have a unique set of skills that also really benefit their recovery and their quality of life. And things that we are able to help highlight and transfer from service into civilian life. So a sense of connectedness, of course, we want our folks to be connected to peer groups, people that they have things in common with, and especially, a positive impact group. If there are, people that specifically don't use substances, or places that aren't, centered around substance use, that can be a really big help, and is honestly hard to find. You don't realize how much, social things are centered around drinking or other substance use until you try to stop, and it becomes very apparent. Especially, we were talking about Memorial Day a minute ago, and that's a heavy drinking holiday, right? So yeah, so we can use sober spaces, or just positive people in our lives to help support our folks. A mission and purpose, and having a reason to stay sober, or a reason to work on our mental health recovery and treatment in general. Having a specifically identified a purpose or reason in our life that keeps us motivated for that, even if it evolves and changes over time, can be a really great motivator for folks. And that's something that a lot of military service members can relate to as well, this sense of a mission and a goal-oriented approach to recovery. Of course, our access to healthcare, having this can be access as far as like transportation and eligibility requirements. It can be knowing how to go through the process, and having a building within a reasonable distance from a home, all these things. So those are things that we want to highlight and make sure that our people have access to, and if there are barriers in place, that we're able to help them through. Our employment, income, transportation, stable housing, so a bit similar to those access points, and accessibility in general. These are great positive factors that we can have implemented into somebody's life that can help support them. Problem solving skills, this is a great one, and something that our veterans definitely have down. This is something that is really ingrained in them. Being innovative, being creative with how to problem solve, how to work together to to get through something is something that they're very familiar with. So we like utilizing and transferring that. A sense of spirituality, this is not for everybody, but any this can be a lot of different things in a lot of different ways. And it is considered a generally positive aspect to have in people's lives. This also goes with a sense of community. This also goes with, our being surrounded with people that have similar values that we do, and a similar life outlook can really make a really big difference. Okay, and I'm sorry, I see a couple of things in the chat. I'm going to go back really quick. Disappointed that the VA is stopping the authorizations for them to receive services from CMH. Yeah, this is something that we have, has been a recent change in our budgeting and our restrictions, and they're looking at it a lot closer, and something that we, not only as staff members, but also our community staff members and our veterans, we encourage to continue communicating that this has been a barrier and something that is disappointing and troublesome for our folks, because the whole point of community care is to get more access to treatment. And it's been a rough go the last couple of months as it's been filing out. So yeah, we're feeling that, and our folks are feeling that too. Have already been coming. Yes, and there's we know that people who have gone through community care, like sometimes it's been years, right, that they've built these relationships and this rapport with their providers in the community, and they have a routine, and it feels very safe and reliable. And so to disrupt that, and we want to keep things as consistent and routine as we can, and our folks struggle within mental health and substance use with change and quick shifts, and we know that. So yeah, it's concerning and troublesome. Yeah. What approaches do you use to get the veterans to buy into group and community supports? That's a good question. I think, of course, it depends on the veteran. Maybe Katrina, you have something that you can throw into this as well. I think it depends on the person. Some people are just not group oriented. It's not, they don't always, it doesn't resonate for them, or it doesn't feel like a safe environment for them, which, we can appreciate. It's hard to share things in front of a group of people. But I think offering like some like smaller scale options, bite-sized options, maybe we just try it out as a drop-in. Maybe we, try it with a safe group of people that we already know. Or if that feels worse than strangers, maybe we try strangers first. And yeah, and offering, some gray area options, not just like, you're either in groups or you're an individual. Maybe there's somewhere in between, or like the like peer-led groups can sometimes feel a little bit more palatable rather than a clinician leading groups. And we also have, you all are likely familiar, in addition to our community outpatient clinics, we also have vet centers, which is they were actually started by Vietnam vets who weren't welcome at VA, didn't feel welcome at VA, and they needed a separate space to receive services and feel safe. And so we maintain those, and their structure is different in that our charting system where we put our patient notes doesn't overlap with the hospital and the vet center. So if there's something that, if you receive therapy at the vet center, group therapy at the vet center, and you come to your primary care appointment at John Dingle, we won't be able to see them, the notes. So that can be a good option, or something to mention as one of the options for folks to engage in. Katrina, do you have anything that you wanted to add with, getting folks to engage with community supports or groups?
Not necessarily anything to add, but thank you. No.
Okay, sorry, there's more questions popping up. Would love to see peer supports provided, or the old buddy to buddy program. We have, so MVAA, okay, so there's different tiers, right? So federal VA is, Katrina and I work for federal VA, and then we have our county offices, we have state, and then we have our local folks too. So MVAA is our state agency, and they have a buddy to buddy program that is up and running and able to be accessed, and we can provide that information on how to engage with that too. And that these are also things that help us, because it's separate from federal VA, it might feel a little bit more palatable. And there was a time, so we work very closely with our MVAA folks. We have a great relationship with them. And there was a time that Katrina and I actually asked each other, we're like, do they only hire veterans? Because I don't think I know anybody who works for MVAA that isn't a veteran, which is a great quality. So they have a lot of really well-rounded staff that they can offer all different services and referrals to as well. So we can mention those, and we do have a good number of peer supports both in VA and most of our county offices also have veteran peer supports, even if they're not specifically as veterans, they happen to also be veterans while they are peer support. So we can share that information too, but that is a huge asset to be able to utilize our peers separate from clinicians. Sorry, I'm clicking through. Budgeting changes impacting community care with CMH impacting medical health providers as well. Yes, so yeah, the community care system is being reevaluated completely. So it is both mental health and physical health. Any community care access and consults are all impacted by that system and changes, unfortunately. Yeah, transportation has been a barrier. I think, you know, in general, I feel like anytime we're doing like a root cause analysis is maybe not what I'm looking for, but you know, when we're looking at like our strengths and weaknesses within a community, transportation is always listed. We know that our public transportation is lacking, especially in this state. And we do have a transportation option at VA, but the requirements are very specific and it can still be challenging. So we often partner with other agencies that do different levels of transportation options, even if it's very local. Sometimes that can be a help too. But yeah, absolutely a barrier. And right, if people can't make it to their appointments and they're missing their appointments, then they're no longer eligible for the programs, and it gets the ripple effect snowballing gets quick. Yeah. Yes. Yeah. Yeah, it's unfortunate. We have and so like Katrina mentioned, our catchment is you know, the 5 counties in Southeast Michigan, you know, Metro Detroit, and then north of y'all we have Sanilac County as well. So that's our catchment, and the options between those counties can be very different, which is also a challenge as well. You know, there are a lot of community agencies that, you know, also do substance use treatment that are very easy to refer to, but if they're just as far as you know, as Dingle is from wherever their home is or wherever they stay from, then it might not be a great solution. So that's yeah, it's the access to treatment and physical proximity is challenging. And we really, I know, so VA is, there are, you know, constantly things that are being amended and both expanded, but also reconsidered in different ways. And it's challenging, I think, for our individual clinicians and for our, you know, community-based people, and also for our leadership to you know, consistently change things. And when Katrina and I do these presentations, or even, you know, if we interact with any individual person in the community and they mention these things, you know, the community care changes, or, oh yeah, I lost my transportation voucher, whatever it is, it helps us inform our facility of what the issues are. So the more that we hear these things, the more we're able to bubble things up, even if it feels like it's a drop in the bucket and, oh yeah, I'll let my supervisor know. It doesn't sound like there's action being taken, but the more tallies we have under that category, the more likely it is that that thing will be changed or re-looked at a future time. Every year in October is our new fiscal year, so there's always new things that are happening. And so in general, I encourage you to keep telling us these things that you're noticing in your folks, and also tell your military service members, veterans, to bubble that up their whatever their resources are as well. We encourage you to call leadership at the facility and file those issues that you're seeing utilize all of the resources that are available, because the more we have documentation of these issues, the better we're able to anticipate and hopefully tweak them in the future. But and thank you for advocating for your people. I'm so glad that, that you're able to talk to your people and that they're honest with you about the issues that they're going through, and that you're able to tell us. It means a lot. And these are this is the work of mending these relationships. VA has been in the business of mending relationships since the beginning. So really yeah, appreciate it, even though it's a sour feeling. And yes, we will absolutely provide links and contact information for some of these things. We do have like a specific person that has been on deck to receive issues related to the community care issue. And we have our patient advocates and ways for the, like I said, the chain of command to be bubbled up that way. So we can definitely provide those to you. Okay, sorry. Getting back to our slides. Okay, we talked about sense of spirituality, and we know that having young people in our lives, or in my case, I always talk about having a pet to take care of can be a huge protective factor, and having somebody who's relying on you. Not that we want to like put pressure on people to be like a source of life, but it can be one of many things that helps contribute to a positive life quality. Okay, so we just mentioned that there are some expansions that are happening. So this is one of them. And I'm not going to talk through all of this in detail, but you can read through it if you'd like. But our substance use treatment options have been expanding. We have been working really hard to implement substance use into more of our primary care and whole health settings, as well, to have it less specified and localized, siloed, maybe is a good word. In our specialty mental health clinic, we're trying to dissipate a little bit and have it more accessible in other areas of the hospital for a number of reasons. We want, our providers to feel empowered to make these decisions and help our veterans at different stages of their substance use and mental health journey. And we also, we know that this can help with stigma as well. If you can get, your naltrexone at primary care instead of having to come up to the 7th floor, then it might help you, with your self-image, or, maybe, okay, well, if I'm able to get it through primary care, then there's less, I don't feel special anymore. It doesn't feel like, oh, I need these special services for this special issue that I have. It's just kind of wrapped into my care. Yeah, so that's some of what we've been working on. This also goes, we have specific funding that was designated for different positions to expand. We also, in our mental health clinic, even separate from our specialty clinics, we also have SUD specialists on each general mental health team as well. So that can help carry the weight a little bit and help some of our folks that are not as at as an intense level of their substance use be able to access services prior to being bumped up a level of care. We talked a little bit about our peer supports and those options. And I think that, yeah, that feels good. Great, thank you. Just talked about this, primary care, addressing substance use. This is a good place to help us identify, we have all of our screening processes and our like preventative health screenings at VA, similar to how, like, if you were to go to your own primary care appointment and, you have the check-in process before, and, oh, do you, have you felt, have you been falling in the last 6 months and things like that. So we also have that for mental health at VA. And so it's been, it's a good way for us to screen prior to those specialty appointments and implement some intervention prior to that to feel out and hopefully prevent an escalation. We also have our suicide prevention screenings at these at all of our clinics, and are able to do all of those screenings in any of the clinics. And we also have specialty staff that are able to like meet a patient at whatever clinic they're at to continue those screenings. So yeah, hopefully making it less specialized and more implemented into all of our different departments. So some of the evidence-based interventions that VA has, we do have our medication-assisted treatment programming, our Vivitrol, our Suboxone, our methadone programs, and those are always evolving as well. And that is also something that we're trying to implement into different areas, rather than yeah, we're trying to implement it throughout our medical center. We also have our medications to help with withdrawal symptoms. We have we have our inpatient mental health unit. We have our domiciliary, which you all might be familiar with as well. So lots of different levels. I think we also have a semi-intensive outpatient treatment right now. So those programs are consistently changing and being tweaked and to best serve our population. Great. And if you have specific questions about these, like Katrina said at the beginning, we were in our substance use team prior to this position. So we do have, a great deal of experience, and those programs have changed since we've left. So if there are specific questions about these programs that you'd like answered, do let us know. We can bring those up to our substance use staff for more direct descriptions of what the programming is right now. Okay, so our whole health team, looped into our, as an offshoot of our primary care mental health integration programming, we also have a whole health program. This also overlaps with some of our pain treatment. So at VA, or at Detroit VA, we have an acupuncture program. We have several different movement courses. We have, information on how to best obtain, get nutrients into our system, and trainings on food and intake, things like that. And so all those things are looped into our whole health system. And this is also hopefully implemented into all of our other departments as well, offering these options as, things that are within our own control as best as we can to help prevent further escalation of our mental health and substance use, and to help with some of those coping skills to get us through when we do have hard times, and when we do notice that those are getting to us. This is also looped into our, shared decision making with our patients. Of course, we want our vets to feel like they are a part of the decision when we're making, a treatment plan for them. This is empowerment, and feeling involved in your own care is important, and is a protective factor as well. Just like, we would all want to be included in our own treatment decisions, and we want our providers to take us seriously when we mention something that we're experiencing. So we also hold that to be important to us at VA. And skill building, integrating this into all different levels, and also utilizing our community supports to help support these as well. Okay. Thank you. So just another view of our whole health system, and the different aspects that go into it. We want our clinical care, our independent self-care when we're at home, our community involvement and engagement to be a part of our care, and all of these things together creates a system of whole health within our lives. And it can sound a little like woo-woo, some of the things that we have, but but there's more and more research behind these things, and especially the more that that medications are being you know, there are changes in the medication system, and a lot of our folks, civilians included, and also veterans, do not want to have medications as their, you know, front runner coping skill. So we're hopeful to have more of these skills built in, and just more of a general awareness of ourselves and our bodies, knowing how to listen to ourselves, knowing how to communicate our beliefs and our thoughts and our feelings, can be a huge factor in our relationships and in our lives. And seeing how these things impact the rest of our treatment, right? Katrina mentioned earlier being hungry, right? It can seem so simple, and of course I'm going to eat, right? But that's not necessarily true. And those things can be impacted and can perpetuate a lot of our issues, separate from included in our substance use and our mental health, and also just our quality of life overall. And we also, something I wanted to mention too, you all likely maybe are familiar, we have a chaplain program at the VA as well. And they are equipped to discuss any level of spirituality, any category of spirituality, different denominations, and offer services related to that, or get you connected to services that are related to that. If you want to explore spirituality, they're also available. So just another good option for our folks to explore themselves, and their value system is available. Okay. And just want to draw our parallels to our recovery model, and these, you know, categories of what impacts our recovery. And maybe this is obvious, but I always like to be reminded of it too, and to see the, you know, how it can impact our recovery, whether it is from substance use or general mental health, or just, you know, our quality of life. The idea is for it to be strengths-based, and not shame or guilt-driven. The idea is for it to be person-centered and patient-centered, and that there is an active involvement from the patient. That there are many ways, many options. I always like to say I like to have a menu to choose from of things that I'm able to engage in, and so I expect that veterans and the folks that I interact with would also like a menu of options, and maybe today movement feels good, and maybe tomorrow church feels good, and, you know, and somewhere in between that people can choose from to interact with, and all of those things build on top of each other. I also want to say too, there was something, I can't remember now what made me think of it, but oh, maybe it was the triggers that we were talking about, folks feeling, you know, that there are certain times and spaces that people feel the most activated and can feel their body or their mind responding to something. And something that I like to keep in mind too, not that we can make this assumption, but just that it is an option for us to think about, is that our veterans, folks who have enlisted in the military, already have a higher probability and a higher rate of their ACE scores prior to enlisting, which, you know, when we look at like our cumulative trauma in our lives, can make a really big difference. And that can also mean that there are certain things in our adult life that brings us all the way back to childhood, whether we served or not. And I know those are things that, you know, we all experience in our jobs regularly, but it's a good reminder when we're thinking about the big picture and how it all layers on top of each other. We also have our cultural differences in here, and this is something that we, you know, are working on continuously to learn more about as clinicians, and to respect and appreciate. And this can be utilized in our whole health and our general treatment, and, you know, medical treatment, and also in different kinds of recovery. So just something to keep in mind, as you might experience, you know, patients who are of different cultures from yourself, or even the same culture. There's so much variation within races, religions, genders, all things. So just another thing to be reminded of. Okay, and I'm going to go back up a little bit because I think there are more questions. Okay, you mentioned the links, yes. Why can't my individual get a Vivitrol shot at the VA healthcare center in Yale? Unable to get it at Dingle. She was doing very well and is slipping because the bus broke down to take her there. Oh, so okay, so she was getting at Detroit. It wasn't, the bus broke down, so she wasn't able to go. And then she was trying to get it at Yale. And I don't know, I will have to ask what the Yale programming is for Vivitrol. I don't know offhand. Katrina, do you have any?
I don't have a specific answer for that situation. There could be a few things in terms of if it was ordered ahead of time, they might only have a certain amount available.
Mhm.
There could be different nuances, but if that person is still in need of Vivitrol and it's a access issue, and we need to look at why the issue with Yale, if it was circumstantial or if it's a ongoing issue, we definitely could look into that for you.
Mhm.
Um, but there might be things, depending on who's ordering it and the supply, and there could be a lot of different things. Was the person able to get what they needed eventually, or is that an open issue? We're coming up on time, so I want to do some.
Sounds like it was open. Yeah, it's an open issue. Okay, so maybe reach out to us and give maybe the person's contact or identifiable information, and we can look into it for you and see what the issue might be. Thank you though for bringing it up. Domiciliary is used for many things, so it is meant as homelessness prevention and intervention. There's intensive treatment for mental health, but also substance use that's a part of the domiciliary program. They also have some of the intensive outpatient things there, but the domiciliary is also meant as a residential option for homelessness that we have. And we have a new location that's on Jefferson now. It moved a couple of years ago.
And
Yeah,
I mean, you kind of already said it, but excuse me, just to highlight that they've created the infrastructure for at least 20 to 30 beds that are substance use track only. And that's newer within the past few years. So that might be a little bit of what that person's asking about too. It's similar programming to Battle Creek that you may have had people speak about because that program's been up and running for a long time. But it's nice that we have a location now in Detroit.
Thank you. And I'm going to put our contact emails in here again. I put them earlier, but it's probably, so you don't have to scroll back up through it. So please send any specific, if there are like specific case issues that you all have experienced, that you are still open and need like more options to dig into, let us know and we can look into them for you. And yes, Vivitrol is expensive, and the for a minute there it was on, like there was a shortage, or was that a different medication? I heard something about a shortage of one of the medication assisted treatments.
I think it was naltrexone.
Oh, okay. Yeah. So yeah, it's a moving target and can be challenging. Okay. We are up on our time, but thank you all so much. And do let us know if there's anything else that we can help provide on behalf of VA. And thank you all for your engagement and questions. Really appreciate it.
Great. Thank you, Katrina and Christina, for all the information and for taking the time to be with us today. We really appreciate it. And to all of you for attending this session, we hope you found the information shared valuable. Today's presentation is one of many webinars scheduled throughout the month of September. Our last presentation is scheduled for tomorrow at 1 o'clock and is the wrap up, which will discuss treatment and prevention of substance use disorders in St. Clair County. To see information, visit our website at www.sccmh.org. Before we wrap up, we would greatly appreciate your feedback on today's session. A survey link will pop up on your screen once you exit the webinar, and we kindly ask that you take a few minutes to complete it. Your input is crucial in helping us improve future events and better meet your needs. For those of you that are requesting professional credits, please allow 2 to 3 weeks for the summit after the summit has concluded, and your certificate will be emailed to you. Thanks again for joining us today, and we look forward to seeing you next time. And thank you both.
Thank you.